Obesity is a complex condition and not just a cosmetic concern. It is a medical condition which increases the risk of having many other medical diseases. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about obesity or being overweight and know more about this condition and various treatment options to tackle this. Joining our discussion today is Dr. Kona Lakshmi Kumari, Senior Consultant Surgical Gastroenterologist and Bariatric Surgeon from Yashoda Hospitals. Welcome to the program, Doctor.
Thank you.
So, Doctor, we are witnessing an epidemiological shift. Over the years, the Indian population has transformed from being underweight to overweight. So why do you think this has changed?
Over time, there has been modernization in the civilization. And with modernization, we have started adapting a sedentary lifestyle and a Western way of eating. So maybe because of the busy schedules and thinking that West diet is easier diet and a better diet. So we started adapting the Western way of eating. And then we started becoming sedentary because of the advancement in the electronic gadgets, the help available in way of different gadgets, and increased available of vehicles for movement. So we have stopped walking, stopped using the stairs, and eating a very refined diet. So that's why we are seeing obesity increasing.
So discussing about obesity, Doctor, what exactly is obesity, and do you see this as a disease or a medical condition?
When a person is, say, a 5-10 kgs above their ideal body weight, we call them as overweight. But when they cross beyond that, then they start going into obesity. And there are different grades of obesity depending on their body mass index. And obesity is just not that a person looks huge or big, but it is a disease. So when your weight starts becoming a medical issue, it is called obesity. And when obesity becomes a life risk for you, it is called morbid obesity.
So discussing about obesity, Doctor, what are the health risks which are associated with obesity, and how does that impact the overall well-being of a person?
Obesity is a metabolic disorder plus a whole lot of weight which is exerted on various organs, and specifically the delicate organs like your heart and lungs, which get easily damaged. So obese people are more prone for developing cardiac issues, more prone for damaging their lungs easily. That is what we see with a lot of people having obstructive sleep apnea and using BiPAPs. And then we have people who are easily prone to getting cerebral strokes. And as we come down, we have type 2 diabetes. Like India is the type 2 diabetes capital of the world. And then you see the number of orthopedic centers doing joint replacements. At least more than 50% of those individuals getting their joints repaired are obese, young obese people. So what were diseases of the old age have now become diseases of the young adults and the middle-aged people. Then we see a lot of infertility. You see so many infertility centers, and at least there also you see 40-50% of the ladies are obese and they are struggling to conceive. Similarly, we have a lot of psychosocial disarray in these individuals. They are not able to come to terms that they are not able to take part in the active lifestyle, so they become depressed. So from top to head to the little toe, every organ gets damaged because of obesity. So also your self-confidence goes for a toss, and you become socially reclusive and medically also a reclusive.
So obesity can affect every body part, but still it's not discussed openly. Why do you think we are seeing this scenario, Doctor?
First is the society still looks at a overweight or obese individual with a negative eye. Obesity is always linked with laziness. Oh, this person is lazy or not really bothered about themselves and are not productive. So no one takes an obese person seriously, that I will entrust a work to this individual and they'll be able to carry out. We'll think, okay, he may not be able to walk fast, or she may not be able to do the work as. So they fall into the neglected group in the social hierarchy. So that is why, and then no one wants to listen to them. No one wants to tell them that what to do. Everyone will say, okay, you do diet and exercise. But it is not always diet and exercise can help that individual beyond a point. Like for diabetes, initially, yes, your diet and exercise may help your sugar control. But beyond a point, you need medicine. So also your cardiac disease or any other disease. Then why obesity is always limited to take care of your diet and do exercise? There are some individuals who have gone beyond the point where diet and exercise will not help. And no one encourages them to look towards medicine and take treatment, and then they criticize the treatment, whichever comes. Even someone wants to come forward, they will talk so much negative about the treatment that this obese individual gets worried and does not want to come and get the treatment done. So it becomes one vicious cycle, and the person who suffers is the one who is suffering with the weight.
So I'm sure there are many reasons why some people are obese or overweight, or some people find difficult in losing weight. So what are some risk factors which are associated with this condition, doctor?
Mainly, it starts with a sedentary lifestyle and eating high-calorie food, and the person starts putting on weight, and then at a point, the fat which is got deposited in the body takes over and itself acts as an endocrine organ and start producing so much of negative hormones in that individual that suppresses their metabolism, and they become resistant to utilizing insulin, which is the main metabolic hormone, what we call insulin resistance, and they develop a problem called metabolic syndrome. Now with this, the whole internal system goes for a toss and they start gaining weight, and as they start gaining weight, their insulin resistance further increases. So it keeps on adding, the fat keeps on adding. Even at a point, people go into following those starvation diets, not eating. When you take their history, they say, we are not eating. But it doesn't matter. After a certain weight gain, whether you eat or not, you start putting on weight. So also certain hormonal changes during an individual's life, like in teenage years, and when the young girls attain their menarche, or ladies during their pregnancy. At these times, the body has a natural tendency to gain weight. But if they are not careful at that moment, then the weight takes over and then it keeps on increasing.
So discussing about latest interventions in managing obesity, what are some most effective interventions that you implement in your clinical practice, doctor?
See, for people, those who are categorized as morbid obesity, for them, the best treating option in the present medical scenario is bariatric or metabolic surgery. Whereas for those people who are still early in their obesity, we have lot of treatments like diet and exercise for some, supervised. For some people, we can use medication for a shorter duration of time. And then also we have the endoscopic interventions like the intragastric balloon and endoscopic sleeve. So these are usually helpful for those between 25 to 30 BMI, where still obesity is not so huge, or obesity is not still associated with the medical problems. But once someone is above 30 BMI and slowly starting to develop medical complications of obesity, the best treatment for them is bariatric surgery.
So discussing about bariatric surgeries, what are the different types of bariatric surgeries and who are the suitable candidates for this?
Yeah, bariatric surgery is a surgical intervention on the stomach and small intestines, which brings about a metabolic change in these individuals. So that causes weight loss, and not only weight loss, it causes a reversal of the metabolic syndrome. So once the metabolic syndrome reverses, means your body is more insulin sensitive and starts working better in metabolizing the deposited fat as an energy source. So to achieve this, there are various types of surgeries under a broad heading called bariatric surgery. But in that, the surgeries are classified according to the way they function. Either we have restrictive procedures like sleeve gastrectomy or metabolic procedures like Roux-en-Y gastric bypass, mini gastric bypass, and the sleeve plus procedures. So each of these procedures, even though they are surgical interventions, they are very safe. Nowadays, bariatric surgery is very safe. We have very good technology, and then we have very good anesthesia. We have very good supportive services. So earlier, people used to get worried of treating or operating on an obese person, but now it is not the same condition. Any type of obesity can safely undergo the surgery, and depending upon the individual profile and what medical problems they are having, we offer them the type of surgery. So each surgery is tailor-made according to the person's individual's requirement, the amount of weight they need to lose, what are the other associated problems. And you have to know that this bariatric surgery also causes an improvement in lot of metabolic problems. Like if someone is a type 2 diabetic and you do this surgery for them, not only their weight comes down, but the sugars also come under normal control without them needing much medication or not even any medication. You can have the sugars controlled. Then similarly with hypertension, their medications will decrease. And those who are in the early joint pains may not need a joint treatment when they lose weight. And mainly with infertility, we see that obese infertile ladies, once they lose weight, they start conceiving and they can safely go through their pregnancy without the obesity coming in their way of the pregnancy.
So I'm sure that most of the lifestyle disorders can be managed once the body weight is under control. So bariatric surgery being a relatively new concept, I'm sure there are a lot of myths surrounding this topic. So would you like to clear the air for us, doctor?
I think, see, whenever we say bariatric surgery to an individual, they talk about some anecdotal reports of some person losing their life because of the surgery and all. When an obese individual who is very, very sick undergoes this surgery, sometimes their other illnesses take over. Means their heart and lungs are badly damaged, and then you're operating them. So if you operate them for any other surgery also, that risk of their heart or lung causing trouble in the middle of the surgery is always there. But otherwise, it's almost, we can say 25 years, bariatric surgery is being practiced in our country. And it has come to a very safe levels, and it's a individual specialty by itself. Like we have orthopedics, we have gynecology, we have cardiac treatments. Similarly, obesity is also a individual specialty to deal this menace of obesity. So I would suggest to anyone thinking of losing weight and contemplating bariatric surgery, don't go by any hearsay. We have been practicing this surgery for almost 25 years, and it's a very safe surgery with very good results, and it almost brings about a change in that individual's life and health and gives them a new life altogether.
So according to a recent survey, more than half of world's population will be obese or overweight by 2035 without significant action. So what steps can be taken to prevent this, doctor?
Yeah, basically, the treatment should be to catch them young. So it is the young population. You see now, obesity has become a major problem in the children, school-going children. You see, at least 50% of the children are chubby. So it means already they are having excess body weight. So over time, these people will grow into obese adults. So they start becoming sick at a very young age. So the children should be taught to again eat a healthy diet and exercise. Now a lot of schools only concentrate on studies and grades. That is what is focused. In the meantime, they don't bother. This child is not getting exercise and they're putting on weight. They're not able to cope up with stress. So that is all a part of social responsibility of the whole society, that the next generation which is coming up should be healthy. See, then only we can face the whole world. Otherwise, if we have a whole bunch of sick young adults, then how much repercussions it will have on the work, on the economy of this country. At school, I think like moral science, nutrition and exercise should be taken very seriously.
I think you made a very important point. So before we wrap this episode, Doctor, what message you would like to share with the audience out there as far as obesity is concerned?
I would say don't take obesity lightly. It is the major killer epidemic like COVID, which is going to stay with us forever if we are not going to take care first to prevent it, next to treat it. So prevention, we can put effort, but already there are some people who are already on the obese side and suffering with it. My suggestion to them is get yourself treated. There is no negative things thought about treatments for obesity. It will give you a chance to live a better and healthier life for a longer duration.
So thank you, Doctor. It was wonderful having you here on the episode today.
Thank you.
So obesity is a complex medical condition which are associated with many other diseases. But remember, even losing a moderate weight can help prevent getting other diseases which are associated with obesity. Do join us for next week as well for more insightful discussions on the Health Talk session. Until then, take care and stay healthy. Thank you.